Welcome to Tech Talks. I'm Holly Scott. Today's discussion centers on innovation in stroke treatment. As we sit in one of the most advanced countries in the world, cerebral stroke is still one of the biggest killers globally. And I am lucky and fortunate to sit with John Wainwright, the VP of R&D, as well as Bob Colloton, the CEO of Mivi Neuroscience, an innovative company that is looking to change this paradigm. Thank you both for joining today.
Thank you for having us.
Yeah.
Thanks, Holly.
Bob, I'd love to start with you. You know, we go way back. You've been in the industry a long time. So share with us a bit about what drew you to Mivi and stroke in particular, and what drew you to Mivi.
It's a good question, Holly. I've been lucky enough to be in neurointervention for about 18 years. At first, I was in the hemorrhagic side of neurointervention with coils at a company called Micris. And then subsequently years later in ischemic stroke, when ischemic stroke exploded about 8 years ago, and became very aware of the importance of not only removing the clot out of the brain in the ischemic stroke, but also making sure that any fragments or any distal emboli don't occur. And I became aware of the technology called DAISY, which Mivi had for 6 or 7 years. And I was always intrigued by it. I always thought that this was clearly the answer, and talking to neurointerventionists around the world, protecting the distal bed was really important to them. So after the stent retriever company that I was working with was acquired by a strategic, basically went and connected with Mivi and became a consultant. And then from consulting to chief commercial officer, now to CEO. Because I truly believe the technologies we are developing and are on the verge of launching in the United States are truly transformative for the patient. And that's ultimately what we're all about. So yeah, that's how I found Mivi.
Mm-hmm. That personal passion, that draw over the years, it really pulls us to where we're supposed to be. What ischemic in particular, that's the largest occurrence, correct? That's the largest in terms of stroke?
It is. So this is essentially where a blood clot blocks the brain. And until about 10 years ago, the common treatment for that was a clot busting drug called TPA. And as you can imagine, if you put the clot busting drug into the vessel, the clot breaks up, but then the clot just travels further into the brain, which causes complications. There was a series of clinical studies that proved that removing the clot out of the brain had true physiologic improvements. And that really opened up the market. And so now we're talking about a market that has in the United States anywhere between 50 and 60,000 cases, growing at 20 to 30% a year. So it's more physicians are performing it. The systems of care are getting better to get the patients into the hospitals faster. I call it the perfect storm of improvement. So we'll see not only in the United States, but around the world, a significant increase in stroke treatments and ultimately better outcomes for those patients.
So what makes DAISY unique in the market when you look at the current standard of care and the intervention, the procedure itself?
So we've developed two technologies. The first is an aspiration technology called the Q catheter. And it's the first unique aspiration device to hit the market when we arrive. In the last 10 years, it's an entirely new way to do aspiration. And that way, we believe we'll enter the market in an innovative way, helping patients. But then DAISY is the secondary technology that really, not only does it provide some stent-like ischemia or stent retriever-like impact, it also provides a backstop, if you will, for any kind of fragmentation or fracturing of the clot that causes distal emboli. Mm-hmm. So that's clearly the benefit of that technology. And that's what we believe will be truly transformative and really introduce a new way to treat stroke.
Mm-hmm. Which even, again, in today's day and age is still, what, number 2 killer in the world?
It is.
It's unbelievable. So aspiration's first line, and then actual retrieval is second line of defense. Am I understanding that correctly?
And that's even today. Mm-hmm. I mean, today in the marketplace, and the vast majority of cases that are being done are called large vessel occlusions. And like any vascular marketplace like cardiology, the main treatments start in the proximal or the close vessels, the larger vessels. And where the challenges really come is as you go further and further distal, these vessels get smaller, they get more tortuous, the clot composition changes. And today in our marketplace, there's pretty effective solutions for the proximal, and there's lots of competitors. For us, our focus has been the distal segment, not only treating the distal segment with unique devices, getting in there, getting the clot out, but also, again, with Daisy, that ultimately would protect the distal segment from having aberrant clot or distal emboli occur. So that's really the focus, but of what we're doing.
So you're going after the more complicated of the most complicated procedures.
It is, and I call it, we're going to do a twofer. The first is these technologies will clearly be effective in the proximal segment, and we'll compete in that segment against the quote unquote big guys. But where we'll have our killer app, if you will, is in the distal segment, and that's what we're focused on.
That's tremendous. And you're not the only one from the neurovascular world, right, in terms of the leadership team?
Well, no, not really. That's probably the thing I'm proudest of since I became CEO is building the senior management team. When I arrived, we had, currently we have 2 people that when I arrived were on the team, Randy LeBounty, who's our VP Regulatory Clinical, and then Tina King, who's our Director of Marketing. But when I arrived, there was a real key, when I became CEO, I should say, there was a real need for operational excellence. And we reached out to a gentleman named Mike Costello, who had been with he's a Minneapolis legend. He has been with several startups that have been acquired by Boston Scientific, by other large strategics for, $500, $600, $700 million. Truly a startup to development to sale guy. So he came in and rounded out our operational capability. After that, we realized we needed a development expert, somebody who could lead the way, who had tons of experience in neuro. And we got lucky enough to work with the Mullings group and found John Wainwright, who was a director of R&D at Medtronic. PhD, great experience with physicians. We were so lucky to get John onto the team. And he's made a vital impact to the organization. And so not only from product development, but overall company organization. So that's been great. Most recently, we added our CFO, Tim Hauk, who has extensive business development experience, worked for Medtronic for many, many years, also has recent startup experience as a business development. And I think that's a critical add for us, because if you look at our marketplace, I always say we're ready for a tectonic shift. There's large strategics, there's lots of small companies coming up with innovative technologies. There's other large strategics that are looking from the fringe to see if this is a market they want to get into because of the market growth. Tim's experience in business development was vital for us as we go out and make licenses, make acquisitions, form partnerships. So that's been a real key asset to him. On the horizon, as we move forward through the FDA, we'll be putting together a U.S. commercial footprint with a U.S. senior person. And then we also have Nick Perio, who's our European director, who is, I call him my Swiss Army knife. He's got clinical as well as commercial experience and commercial responsibility here at Mivi, and doing a great job on there. So yeah, our team has really flourished in the last 9 months, and everything's moving forward.
Excellent. Yeah, when I zoom out and I look at the last 3 decades and the innovation, cardiovascular, you and I both lived through it, was just the days of the 90s and, growth and the answers there. It is certainly time for neurovascular to be that rocket ship, right? We've gone after so much of this in so many ways, but now getting in and really improving the outcomes and improving the delivery and the patient experience, the clinician experience. I'm bullish about this market. It's quite exciting.
It's true. I mean, I lived through as you said, we lived through the cardiovascular experience. And when we go out and raise money, most of the early cardiovascular investors that we talk to see a mirror to the cardiovascular market that they do to the neuro market. The same type of market growth, the same type of technology improvement, all focused on improving clinical outcomes and actually improving clinical outcomes. And so, yeah, this is a market that's just ripe for expansion, and not just in the United States. As I said, China is quickly becoming the largest market. They're actually building specific stroke hospitals. The world is waking up to stroke and being driven by lots of key opinion leaders in the United States and around the world, as well as with, companies like ours that are coming up with better and better solutions.
Yeah, no, and there was a time when the neurovascular interventionalists were such a tough nut to crack, and now that we're getting to a point where there is more opportunity and innovation for the patient, you've ridden that time, and now it's coming around. So it's exciting. I know we're on the cusp of something great here.
We are.
Yeah. Well, I'd love to bring John in on this, because John, not only are you incredibly impressive because your early academic career was from University of Florida and you're a Gator, but you're also a PhD. You studied the cardiovascular system early as well, and materials, tissues, I believe, as well. I'm going from memory on that, and then a legacy in neuro. So please share with us what a little bit more about your path and what brought you to Mivi. What was interesting to you about Mivi?
Yeah, so a couple things really stood out to me with Mivi. That my life goal is to save millions of lives in a beneficial environment, and by developing devices to treat stroke better, I think I have that opportunity to partner with physicians and the healthcare community to achieve that goal. Bob mentioned that China is this growing market, and it's a huge problem, and I think one that we're well poised to help improve. The other part of it is the technology. That I started my career in peripheral vascular, and for every carotid stent that is put in, you have a distal protection filter. You move 5 inches north and there is no protection. So it was something that just intuitively made sense for me. The other part of it is the Q catheter. As we're treating more distal vessels, we need a different way to do it. And because you're limited by space, the Q provides an additional benefit with that higher flow. And we're seeing some early results that look really beneficial compared to the previous history.
That's interesting. And going back to that point where you said, boy, there's just 5 inches longer, it makes such a big difference. What are some of the engineering challenges and considerations that go into creating that lengthier catheter stay and that access?
Yeah, so one of the biggest challenges is just the tortuosity. You see a lateral image of the vasculature of the brain behind me, and you can see that those curves are quite tight. And so you need to be able to get into these small vessels with a very flexible device and pull that clot out without causing more trauma. If you think about the brain, it's really floating inside of your skull, and you don't want to put a lot of force on that. And so that's where I think the combination of the DAISY device, which is a soft polymer fiber, plus the Q catheter really makes a great pairing for these MEVO treatments, medium vessel occlusions.
Interesting. So as someone who, from a technology lead perspective, you've seen innovation in the cardiovascular world, and you've seen some of the challenges there. As someone slides into, or perhaps has interest in sliding into, a neuro application, what are some of the headwinds and some of the opportunities that someone might walk into coming in, first day?
Yeah, my neurovascular experience, it took me probably a year to kind of understand what the differences were, and probably 3 or more to really figure out how to make a benefit because of those differences. The tortuosity and the navigation is probably one of the most critical things. Also, just the delicate nature of the brain. You lose 1.9 million neurons per minute. So time really is brain, and getting the whole clot out in one pass all together is going to be so critical for the patient to have a good recovery.
Tell me a little more about the aspiration side. What's the advantage of our outcomes when it comes to the aspiration device versus the current standard of care?
Sure. The Q catheter has a couple unique technology features. It's really an extension catheter. So it sits on the end of the guide, and it's compatible with any 88 to 90 guide currently. And with that, it can remove ledge effects for the guide, and also aid in the navigation. So you can get more distally with the Q catheter easier because of its tapered design and this rapid exchange type platform. We see this having future benefits for radial access, and we've already discussed especially the benefit for these smaller vessel occlusions where you're really limited by the vessel size with how large of an aspiration catheter you get there. Recent publications have shown that stent retrievers cause more damage than traditional aspiration catheters. But traditional aspiration catheters aren't as good as getting the clot out of these small vessels. So I think the Q catheter is very well set up to change that paradigm.
So as you think about where we're going, and as stroke is continuing to evolve, and let's just pretend for a minute that you have limitless resources and limitless time, money, everything. Well, what would be the next frontier as we're looking at stroke and the health of the stroke patient?
Yeah, in the short term, it is really these medium vessel occlusions. There's multiple studies ongoing now that I'm sure will prove the benefit of removing the clot from these smaller vessels. A lot of strokes happen in the middle cerebral artery, and that controls your face, arm, and speech. That's why there's the acronym FAST. If you have any face droop, speech slurring, or trouble raising your arm, then it's time to get the hospital. And so with that, those are critical areas that you might not be fully disabled, but you're not going to be able to go back to your normal life. So treating these smaller vessels is going to be so important, especially for younger patients that are still active in the workforce or have a family to raise. Beyond that, it's really getting treatment to more patients. If you look worldwide, about 14% of ischemic strokes are treated. But if you look at the smaller countries, it's less than 3%. And so that's really the critical benefit of making a treatment that's simple and works well, and that you can really get to more patients across the world.
Does the tech and the innovation fit into the current workflow for the neuro interventionalist right now?
It does, and part of it is around training and having these cath labs available worldwide, and then I think new technology is making that implementation of these procedures much easier. Last week we had a nice robotics demonstration at WLNC where we combined our Q catheter with the Corindus robot to show that aspiration was possible. And if we take this a few more steps, you could think about doing this remotely. And that's how this technology really starts benefiting. And I think, again, because of the design of the Q and the Daisy, it's very nicely set up for these type of procedures.
Simplicity is everything in that context. That's where we can really make the impact with the simplicity and elegance of the product, and having potentially that scalability. And we're seeing that in every facet of medicine in terms of going towards more of a democratized and accessibility approach. So I'm glad to hear that that's on the horizon. It gives us hope. It gives us hope. Well, this is excellent. I truly appreciate both of you so much for joining me today and sharing dialogue on this important topic. As I look at the evolving marketplace, it's an interesting time. We have focused in medical devices, in healthcare, health tech, life sciences for 3 decades, and it's always interesting to watch where money and investment goes as times change and evolve, and as we may be seeing some softening and dipping in some segments, it'll be very interesting to see what other segments enjoy. And it's been my experience that quite often the big market opportunities with significant tried and true patient benefit that are fit nicely into the current clinical experience and can make their life easier and make patients' lives, make their outcomes better, they win. So I'm bullish on you all at Mivi, and look forward to what the future holds.
Awesome.
Yeah. Thank you both for joining, and audience, thank you for joining us on Tech Talks. See you soon.